I'm Allison Lacivita, physician assistant student at the University of Pittsburgh. I have performed my hand hygiene, wearing my gloves. I'm dressed professionally, and I have my name tag. I'm here today to perform a HEENT exam. My patient is on a clean exam table with clean paper, and I'm ready to start. Could I please have your name and date of birth?
Matt Bear, 8/1991.
Wonderful. Are you ready to begin?
Yep.
Okay. So first thing I'm going to do is the head exam. So I'm going to inspect the head, look for any ecchymosis, any deformities, any masses or lesions. Have you had any pain recently in your head or in your face?
Nope.
Okay, so I'm going to palpate now, looking for any tenderness, any deformities, and there's none. Wonderful. Okay, moving on to the eye portion of the exam. So you're wearing your corrective lenses. I'll ask you to keep those on. So first I am going to stand about 6 feet back and then ask you to cover your right eye. And can you read the smallest line that you can, left to right?
LTFPH.
Wonderful. Can you cover your other eye? And read the smallest line that you can from right to left.
HP or HFPTL.
Wonderful. Thank you so much. All right. So now to test some visual fields and peripheral vision. I'm going to start with my hands just behind your head, and then I'm going to move my fingers forward, and I want you to say stop when my fingers come into your field of vision.
Stop. 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 Stop.
Okay, excellent. All right, and I'd like you to, with just your eyes without moving your head, just follow my fingers. And there, I'm checking for pupil accommodation. And while I was doing that, I was inspecting the eyelids, the eyelashes, the sclera, the pupils, the irides, the bulbar conjunctiva, the palpebral conjunctiva, and the lacrimal ducts and the lacrimal glands. So I'm going to ask you to look up. Wonderful. And the other eye. Up. Wonderful. Thank you so much. Okay. So pupil exam. Let's see, well, first for alignment and positioning. So, here, equal, wonderful. And can I have you take your glasses off? Thank you very much. Okay, so let's see, direct, and consensual, and direct, and consensual. Alright, thank you so much. And now we've moved on to the fundoscopic exam. So while I'm doing this, I'm looking at the optic disc for color, clarity, for symmetry, for any papilledema, and for the physiological cup. I'm also looking at the retina for arteries, veins, for the arteriovenous junctions, for any hemorrhaging, cysts, exudates, or edema, and I'm also looking at the fovea macula for hemorrhages, cysts, exudates. Alright, so I'll start about 15 inches away, coming at a 15-degree angle. Alright, and you can just look point straight ahead. Okay, excellent. And excellent. Thank you so much. And you can put your glasses back on. Alright, and that concludes the eye portion of the exam. Alright, so I will now start the ear exam. Have you had any pain or tenderness recently in either of your ears?
Nope.
Okay, wonderful. So I'm inspecting them. I'm looking at the helix, looking at the tragus on both ears, looking at the mastoid process, the external soft tissue. Wonderful. Okay, now I'll palpate. So I'm pulling gently in the helix, pressing the tragus. No pain there. Wonderful. Okay. No pain here?
Mm-mm.
Alright, now I'll begin the otoscopic exam. So I'm looking in the external ear canal for any erythema, any edema, and I'll be looking for the tympanic membrane, looking for the bony prominences, the cone of light, and any erythema. Oh. Alright, excellent. Thank you so much. Alright, and I'll start with the hearing tests. Alright, so I'm going to cover your left ear, and I'm going to whisper 2 words. You can repeat them back to me.
Ear test. Orange cat.
Okay, perfect. Thank you so much. Alright, so I'm going to strike those places on the center of your head, and I'd like you to tell me if you can hear this more in the left, in the right, or symmetrical in the center.
Symmetrical.
Excellent. Okay, so I'm going to strike this here. I'm going to ask you if you hear anything, and then change it to ask you when it stops, if you do hear something.
Yep, I can hear it.
And when it stops?
Now.
Okay, thank you.
Yep, I can hear it.
And when it stops?
Now.
Excellent. Okay. Alright, and now we'll move on to the nose exam. Have you had any pain or tenderness in your nose recently?
Nope.
Alright, so I'm inspecting it, looking for any masses, any deformities. Then I will palpate. So I'm going to feel here, see if there's any deformities, any crepitus. Nope. You tip your head back slightly. Alright. A little forward. Okay, so I'm looking here straight back. So I'm assessing the nasal mucosa, the nasal septum, the turbinates, and looking for any signs of septal hematoma. And last, I'll check the nasal patency. So I'm going to occlude one of your nostrils and just take a deep breath through the other one. All right. Perfect. Thank you. All right, then last, just palpating the sinuses, the frontal and the maxillary. Hear any tenderness?
Nope.
Nothing here?
Mm-mm.
Wonderful. Okay. Alright, now we're moving on to the mouth and neck exam. Have you had any pain in your oral area, your teeth recently? Nope. Okay, wonderful. Could you open wide and say ah?
Ah.
Okay. Alright, so here I'm checking for I'm looking at the oral mucosa, buccal mucosa, the gingival mucosa, the soft and hard palate, the posterior pharynx, checking for airway patency, looking at the tonsils for symmetry, for any edema, for any erythema, and also the uvula. Right. And then you've had no pain in your teeth recently?
Nope.
Okay, could you open up once again? Alright, so I'm just gently tapping each tooth to see if there is any pain, which there is not. Fabulous. Okay. Alright, moving on to the neck. Inspecting the anterior neck, I'm looking at the trachea, seeing if it's midline, looking for any masses, any deformities. And before I do any palpation, I'm going to auscultate for carotid bruits. Alright. Here I palpate. Here I got the salivary glands, the parotid glands, the submandibular glands. Just assessing the neck here, looking at the trachea, its midline, any masses, any lesions, any deformities. And I'm going to then check the lymph nodes for any lymphadenopathy. So the occipital, postauricular, preauricular, the parotid, tonsillar, submandibular, submental, the posterior cervical, anterior cervical, supraclavicular, infraclavicular, the central, the lateral, the subscapular, the pectoral, and the epitrochlear. Okay, excellent. Okay, so moving on to the thyroid exam. Could I have you tip your chin up just slightly? Thank you. Alright, I'm looking at the thyroid, see if I see any masses, any deformities. And I'm just gonna shine this up gently. Nope, there's no shadow. Going to ask you, would you please take a sip of water with your chin tilted up just a bit? Perfect, thank you. Alright, so I'm looking there for any lumps, any deformities, masses, and then I'm going to palpate the thyroid isthmus from the front, and then would you tip your chin down towards your chest? Alright, so here I'm checking for the cricoid cartilage, the thyroid isthmus, assessing the lobe, if there's any masses, any lumps, in terms of symmetry. And if I were to find any enlargement of the thyroid, I would then auscultate here. And that concludes the HEENT exam. I will leave the room so my patient can get dressed. I will take off my gloves and perform hand hygiene, and the end.